Hello everyone, welcome back to the channel Homeopathy Remedy Marvels. So the condition that we will discuss is becoming more and more common in our clinical practice these days, and we come across many cases of GERD where a patient comes with diagnosis in hand and they come and ask how homeopathy can work in such cases. Now, before I give you the list of remedies that can be thought of in cases of GERD, let's go through what exactly is GERD, what are the changes that happen in the gastroesophageal junction, what are the predisposing factors, who are the high risk patients, what are the symptoms that they present, what complications can happen, and what are the red flag signs that we must look in our patients and be very aware of what could be the complications and how do we manage that case, and then of course the investigations of choice. So basically GERD is a disorder where there is dysfunctioning of lower esophageal sphincter. Now what exactly it is? This is the this is the esophagus, this is our stomach, and here we have a sort of a door which is called as sphincter. Now this is called as lower esophageal sphincter. There is another sphincter at the start of it which is called upper esophageal sphincter, but here we will concentrate on the lower esophageal sphincter. Now this sphincter is a physiological sphincter, so when the food enters it will open, and once the food enters the stomach it will shut back, right? And the lining here is of the lining or the lining of the wall of this esophageal sphincter is squamous cell lining. The cell type is squamous, but when the acid starts to reach up because of dysfunctioning of the lower esophageal sphincter, these cells are affected by the acid and they turn into columnar type of cell. Now the problem here is that these columnar cells eventually form Barrett's esophagus. Okay, and the problem here is that this is a pre-malignant condition because the chances of it to end up having adenocarcinoma is high. It is a pre-malignant condition. Now let's go back to what are the predisposing factors. What predisposes a person to have GERD? Persons will habit like smoking. Hence, we need to advise the patient to stop smoking completely. Alcohol. Patients with hiatus hernia. Conditions where there is increased pressure in the abdomen like pregnancy. So during the last trimester especially, the patient can end up having GERD. Obesity, chronically obese patients, and certain drugs can predispose a person to have GERD. Now we need to be aware of who are the high risk group of patients. Number 1, males over 45 years of age having the symptoms of reflux. Patients having history of severe gastritis. patients who abuse tobacco, and elderly group of patients with reflux symptoms. Now, when I say symptoms of reflux, what are the symptoms of such reflux? The patient will classically tell you that I feel I'm having heartburn. What exactly it is? They actually mean a pain which is of burning type in the retrosternal region. So they will say that I have pain here which is radiating up to my chest region, and it gets worsened after meals, whenever I'm lying down, and whenever I'm stooping. Let's say I'm doing some activity and I stoop, this will become more. And usually you will see that the patient is in the habit of taking antacids multiple times a day. Sometimes after every meal the patient is in the habit of taking antacid. So this is the first symptom, which is the heartburn. Patient can also present with excessive belching. They can come with acid brash, which is actually sour fluid or acidic kind of fluid coming to their mouth. They can come with water brash, which is actually excessive salivation. They can come with odynophagia, which actually means painful swallowing. So they will have difficulty in swallowing, but that is usually in the advanced stages. And they can also complain of difficulty in breathing during the night time when they are lying down. So they can present with nocturnal asthma. Now let's look into the complications of GERD. The first is inflammation. So they can end up having esophagitis. They can have ulcers, which can be seen on upper GI endoscopy. And again, if the healing takes place, so post healing the patient can end up having benign stricture. Of course, I told you that they can have Barrett's esophagus, which is a pre-malignant condition, and one of the complications is adenocarcinoma of stomach. They can have bleeding from the ulcers leading to iron deficiency, anemia. Because of the acid brash, they can have dental erosion. So the enamel can get eroded. Acid coming to the throat can cause acute laryngitis or chronic cough, or they can also end up having asthma. Now, when I told you about high-risk patients, there are certain red flag signs that we must be aware of when we must notice. So let's talk about the red flag signs. The first is dysphagia. The patient starts to complain of difficulty in even swallowing food, and this could actually mean that the patient has developed obstruction. Another is odynophagia, painful swallowing, not just difficulty but painful. Weight loss, again a red flag sign. Easy vomiting. Aspiration, symptoms of aspiration. Constant wheezing or cough. GI bleeding, patient can come with melena or hematemesis. We must suspect GI bleeding. And then, of course, iron deficiency anemia, even after taking supplements. Now, let's see what investigations must be chosen. The first investigation that must be thought of is upper GI endoscopy, where it is seen that the lower esophageal sphincter becomes velvety. We can advise patient barium swallow. We can advise 24-hour esophageal pH, which is most sensitive test. And then, of course, we can go for motility studies if we suspect any motility issues. And the most accurate test is, of course, biopsy. Now, coming to the treatment, I'm going to stick to the homeopathic list of remedies here in cases of GERD. Again, the prescription will be made depending on what the individual case presents with, what are the list of symptoms, what are the modalities, any concomitants, associated complaints. But a small list here can be thought of. First is natrum phos, nux vomica, iris versicolor, robinia, usually given in lower potencies as mother tincture, phosphorus, lycopodium, and carbovage. This is really a small list. There are many remedies working wonderfully in cases of GERD, and it is seen that the cases are really well managed. I hope this information is good enough. You can go and study more in detail. Thank you for watching, and please subscribe the channel for upcoming videos. Thank you.